Megan, thank you for taking the time to come and see us.
You're welcome. Nice to meet you.
Megan, could you let us know your name and your role?
Of course. So my name's Megan Pooley. I'm a team leader and I team lead within Customer First and the Emergency Duty Service for Suffolk Social Care.
Let's take you right back. What was your favourite subject at school?
Goodness, probably art. I really enjoyed art. Yeah, I was quite creative at school, and that sort of led me on to, going to university, and I done media and business at uni. Thoroughly enjoyed that. But no, art was definitely probably one of my strong points as well.
Amazing how many creative people end up working in care, actually.
Absolutely, and I think sometimes, with art or creativity, you think outside the box. It's not necessarily a linear process in terms of how you produce something. So I think in terms of sort of being in a care role or within social care, sometimes you do have to think outside the box.
So you studied business studies at university?
Media and business.
Media and business.
Yes, I did.
And then you finished your studies. Mm-hmm. What do you do next?
That is a very good question. That is exactly the same question I asked myself. It was, I didn't know what I wanted from that. And it is a challenge, I think, with university sometimes. I thoroughly enjoyed it and I wouldn't change it for the world, but it's like, okay, you've got this degree now, where do we go? And it was like, well, you need to find a job. So Customer First were based in Eden Market, where I live. And I found this little job and I thought, well, I'm going to apply for it. It sounds really good. Everything that they asked for, caring for people, having a certain attitude. I thought, I think I can do this. So I applied and I was very successful. I got the job. So I started probably about 5.5 years ago now, and I was an independent and wellbeing advisor. And the role of that role is to take the phone calls, which I thoroughly enjoyed. And I found almost my bag. Do you know what I mean? I found what I wanted, and I made friends. I spoke to professionals, and I thought I really enjoyed what I was doing. And within that role, there's so much opportunity for progression. Although we Customer First sit under the Directorate of Adult and Community Services, we also deal with children and people services as well.
So a really wide remit there.
Absolutely. We also take requests for Mental Health Act assessments as well, and we provide a lot of advice and signposting to professionals and members of the public as well. So it's a very, very busy environment. And not only is it on a telephony platform, we also have a portal referral service, and we also have a web chat service as well, and email. So we've got a lot of channels in which people can contact us by. So in terms of that day-to-day look, it's a lot of sort of juggling plates and making sure that we are prioritising the work that does come in.
Did you have to go into some training? Were you able to do training on the job?
Absolutely. So very much, it was then and it is now, it is very much training on the job as we go along. So when you start in Customer First or an emergency duty service, you'll be provided as a mentor. And that mentor is someone who's already in situ as an advisor, and they will take you on board and take you through that process. So it's usually probably to a 6 to 8 week program as such with your mentor, and during that time you'll start listening into the calls, and as time goes on you will then build upon that. So by the end of 6 to 8 weeks, a team lead will listen into you and see where you are, and hopefully then be able to sign you off for you to then be independent to take those calls yourself.
So there's a lot of support there. It's not like you're just left with a phone and said go.
No, and to be honest with you, if anybody could come in, even if you worked in a contact centre environment before, fantastic, because you understand the mechanism of it.
Great experience to have.
Absolutely, definitely. And I certainly think if anybody thought about coming into that space and they've got that experience, certainly don't hesitate in thinking it's not for me because I don't understand, because you will get that training to understand what to do. And I think for anybody to come in and take those calls, you need to have the training.
So it's different, isn't it? It's not like working in a care home where you're face to face with people.
No.
You're reliant on listening to people on a phone call. And is it difficult because obviously you will then perhaps refer them on to someone else. So it moves on from you. Do you ever wonder?
Absolutely.
what happens next?
Sometimes, absolutely. So sometimes you'll get a call, and what you'll be able to do is what we do, provide a resolution at that front door, which is fantastic if we can. And when we say that, maybe somebody needs to go private or something like that. But some calls, they come through and they are in need of a referral going through to social care. And sometimes, we do get really challenging calls, naturally as part of that role. But we do get those calls that come through where you might have, I don't know, I take as an example, maybe more of an elderly person, not really sure, they haven't got enough money to fund their own care, they're in a bit of need for, a care needs assessment, and you build up a rapport with that person when you're talking on the phone. Sometimes the conversation can fluctuate, and when I say that, it can start off with a person quite emotional because they don't know what to do. It's the first time they've contacted us, they've been independent for so long, and you build up that rapport, you take that referral, and at the end of that call they say, thank you for helping me today. And they'll say to us, what happens next? And you'll say to them, we'll pass it on to the whatever team we pass it on to, and they will be in contact with yourselves. We can never advise in terms of a time frame, but we'll always say, if anything changes at all, please contact us back. And that thank you at the end of the call is very much like you take that away, and that stays with you for the rest of the day, and it's a positive. But on the other token, you think, I wonder what is going to happen next. I wonder, what are they going to get? What's that going to look like for them? But and sometimes you'll never hear about that person again. However, sometimes a couple of weeks later or a week later, the person's on the phone again, saying, hello, I just want to find out what's happening with my referral, and you might get a glimpse of maybe what's happening.
It's interesting, isn't it? Because you would think actually there are people who are working in call centres now who already have some of the skills that you might need in your team. And if they're looking for something, because a lot of those people have to end up dealing with firefighting, really, isn't it? It's that sense of complaints coming at you. And I imagine that would be quite an exhausting thing. But to work in a call centre where you're doing good and you're actively helping people. I think if I'd had experience in a call centre, I'd be quite interested in that.
Absolutely, and I think what I would always say is there's always those, I always say, tiny things about, a complaint. You might get someone call through, and because you are at the front line. First point of contact. Somebody will probably say, look, I'm not happy about this, but majority of the times you can de-escalate that. You can talk to that person, find out a little bit more what's going on, have that conversation. And I certainly think the skills, this is the first contact centre environment I've ever worked in. Right. But I certainly would say if you've got experience within other contact centres, whether that be insurance, whether that be working for the police or NHS or something like that, those skills to be able to, multitask, to listen to someone, to write down the really key points that are going on, are so key to be successful, I think, within an advisory call-taking role. I look at my 5 and so years, within my role, it's from start to finish, and I think in terms of my professional development, certainly that's changed completely, and I think as a person as well, I think you take the skills you've learned maybe into your day-to-day life, to think now I can probably juggle, not physically, but metaphorically juggle about 10 plates. That comes in quite handy sometimes, outside of work as well. And the people that I work with as well, I know that if one of my plates starts slowing down a little bit, I've built up a rapport that I know that they've got my back, know. And I think with where we work, I think, you build up such a good relationship with people. So I say, anybody within a contact centre environment now, please, if you're interested, always let us know.
Megan, we've been talking to people who work in care homes, and one of the things they like about the job is how flexible it can be. I'm imagining that the call centre is perhaps a little more 9 to 5, or is there, how flexible?
Yeah, certainly. So in terms of how we operate at the moment, so as I said, customer first is very much on the premise of 9 to 5. So in terms of shifts, when you start and finish, they're quite obscure times. So we have 3 different types of shifts. We have an early, which is an 8 o'clock. We have an 8:36 start, and we have a 9:15 start. And the finish time staggers as well. So the closing time of our contact centre is 17:24. Really obscure, but it works. Very obscure, but it has to work like that in order to operate for out of hours and ensure that we, people have their contracted hours in that specific time. So if you're applying for a role within customer first, they're going to be your shifts, but the earliest you'll start is 8 o'clock. The latest you'll finish is sort of 5:30 as such. By the time you've wrapped everything up.
Yeah. Do you think the general public are aware about social care and how much work goes into it? Do you think they're aware of it?
That's a really good question. And when you say good, I think there's always that stigma in terms of social care. Sometimes I think what the news or something like that, sometimes you don't necessarily hear all these good stories that come about. So some people might call through and they might say, oh, I'm a bit unsure and they need a bit of advice, etc. But I think that's where, I think as time's moved on, this, COVID, I think, has put a little bit of a halt to it, about engagement going out to members of the public. Recently with the Suffolk show, that's the first time that I'd taken part in my role. It's the first time that the Suffolk show had been back, I think, within sort of the last 2 years. And it was a bit like, I was like, oh, I don't know how many people are going to come into the tent, how many people are going to come and talk to us. But actually, a lot of people came in and a lot of people were curious to find out, oh, okay, well, my friend's got this issue, I'm concerned. And we were able to, wave our hand up a little bit and say, we're here.
That's great.
This is where we can go.
You've got a spot at the Suffolk show, because that's about being visible, isn't it?
Absolutely, yeah. And, the Suffolk show, we were promoting our digital care, but people were still coming up to us and asking questions about social care, and that's really important, and we've got the ability to stand there and talk to them and say, either call us, or you've got our online service where there's lots of information, our Suffolk info link as well, which stores copious amounts of information of services that people can access as well. So and I think as time goes on, the generation, whether that be more elderly at home, people have got access to iPads now, and a lot of people that we speak to, sometimes they might live on their own and they might be, I don't know, you speak to people in their mid-80s and you're like, oh, have you got internet? And they're like, yeah, I've got an iPad. That's
what's changed, isn't it? And I think the pandemic has changed that.
Definitely, absolutely. And I think that's where sort of our digital care as well, within the pandemic we were providing, digital support, and as that's gone on, we've built on that, people have become more aware of it. That's a real positive, but on the same token, you still have people, members of the public, etc., who don't have access to that for whatever reason. And it's really important that we continue to, provide our telephony service to talk to those people, to tell them what we provide. And that's what's so important about, managing that contact centre, to ensure that those people that really need to speak to somebody can get through in a timely manner.
You're in quite a unique position in that you work within the care industry and you have view of so many other aspects of it, because you're always referring them on
Absolutely.
to people. So you must work with occupational therapists.
Yeah.
And what are the other care jobs that you have a regular?
Goodness, so I would say, I'd break it down in terms of adult and community services. So as I said, we work alongside our independent and wellbeing service. So within there you have social workers, practitioners, occupational therapists. So on a daily basis we are constantly talking and seeking advice or discussions with them. We work with our multi-agency safeguarding hubs in both adult and community services and children and young people services. So within that service you have social care, health, education and police. So they look in terms of safeguarding. So again, we pass those sort of referrals on to them, but again we seek advice and guidance from them on a daily basis. And again, in that CYP space as well, we again deal with occupational therapists, disabled children's team, fostering, adoption, and that's just within that sector there. But we also sit alongside our independent our independent living service. So they provide occupational therapy assessments as well. So we sit alongside them as well. We talk to them. We have housing related support. So it's a hub of many of people, many of professionals and job roles that we deal with
And
daily.
I mean, do you ever talk to someone, a professional, and think, I'd like to do that job actually?
Sometimes I do, and I always say, especially social work practitioners, people that are going face to face or, are managing these referrals that we pass through, I think it takes a very unique and special person to do that. And I always say I take my hat off to those people. And I think certainly if you come into customer first in that contact centre environment, you find your niche. I've had quite a few people that I've line managed who have said, actually, Megan, when we have our one-to-ones with each other, I've said, have you ever thought about progression, maybe put this within your PDR, what does that look like for you? And they've said, well, I quite like the idea of working with children, young people, or adult and community services. So once you start that, you think, okay, well, let's have a think about that. You don't have to give me an answer now, because that's a big question to ask. Have a think about it. Let's continue this conversation. What can we do to help you with that? So shadowing and things like that.
This kind of work, it's like being on top of the care mountain, right on the top, and being able to see everything.
Absolutely, and you are. And I think, we get a lot of maybe newly qualified social workers or people that come in practitioner roles or in other departments, and they say, actually, can we come and shadow you for the day and listen to your calls and see what you do? And we're like, of course. So we accommodate that, get them in, pop a headset on, get them listening, and by the end of the day, you literally sort of close their mouth, they're catching flies, and I didn't realise how much you do. And I think that's the thing. I think when you're in it, I naturally do it now. I don't, obviously I think, but it comes natural. Whereas if you sort of come from a bit more of an outside space it opens your eyes up, certainly.
Yeah, I can imagine it does. We've asked this question of many people. Can you recall a funny experience on a call, anything that stuck with you?
It was a lady, bless her, that called, and she had sort of difficulties hearing. And when you're in a contact centre environment, you have to be aware of what's going on around you, not just what's happening to you. So I was having a talk with her, and she said she was wearing hearing aids, so we had a chat, made sure the hearing aid was turned up. She still couldn't hear me, so as my volume got higher, everyone else has got higher, so you're sort of more bit of in a disco environment. So at the time, my line manager came over to me and said, would you like to go into a different room? So at that time we had wireless headsets, so I go in a different room by myself, no computer, and I'm shouting down the phone, can you hear me now? She's like, oh dear, I can hear you really well. I'm thinking, oh my goodness, I'm going to get a sore throat. But that always makes me laugh. But I think at the end of that call, I helped that person, and I always remember that. I think that's why I'm here. I'm here to help, and take those positives.
The nice thing about this job is that if you have a want to help and a want to care, but you're not physically able to do the things that might allow you to do that lifting and all this lifting and handling, this is a way to get into care where you don't,
Definitely.
You sit down. You don't have to do those things, but you're still making a difference.
Absolutely, and I think sometimes it's not about the ability to provide that physical care. It's about whether you want to do that. Physical care and what we do is, is helping people. It is very different, and I think some people, for whatever they don't, I certainly couldn't do that role. Again, I take my hat off to carers every day. I think they do an absolutely fantastic job, they really do. And but as you said, I certainly think by sitting talking to somebody, and the guys that we've got working with us at the moment do a fantastic job. It's a pleasure to sit and listen to their conversations, and you can hear in their voices, that they're thinking, I'm doing a good job. It doesn't come without its challenges and us talking about calls and things like that, but it is extremely rewarding.
So if somebody came up to you and said, I want to do this, I wanted this, your reaction would be, do it, just do it.
Absolutely. I'd probably say to him, what do you want out of it, or why do you like it? What makes the bell sort of go? Because I'm always interested in that. I find it, if they, and 9 times out of 10 it's because I want to help people. I like talking to people. I like this, and that's what we want. That's what we want. We want that passion for people, and that ability to learn. I would say absolutely, please, if you ever see sort of an advert or anything like that for us, as I said, there's always a little number at the bottom. If you want to have a call to have a chat about anything at all, you can do so. But please apply, and it's always great to have new people on board with us and join us. Yeah.
Megan, thank you so much for coming in.
You're welcome. Thank you very much.